Hey, can everybody see him? Yes, okay, good. Okay, so I'm like Allison said, I'm Michelle Swinger Gagne. I'm a school psychologist by training, but work in the University of Rochester medical setting in the Children's Hospital and also teach in our marriage and family therapy training program. And I'm going to tell you a little bit about those settings later on. But my job today is to come and talk with all of you about partnering with families, especially when they're struggling with mental health or stress. Okay, so in the next 25 minutes, I'm going to try to quickly review things that may be familiar and some things that may be new to you, which are barriers and solutions to partnering with families. Okay, as you all know, we are in a youth mental health crisis. That's why you're all here trying to learn more. Um, and if you didn't know, in 2021, the U.S. Surgeon General actually made an announcement and an advisory that to our country that we are in a youth mental health crisis. All of you know that we were in this crisis long before the pandemic, but we're seeing even more challenges for kids with mental health and their families since then. So, 1 in 5 US children as of 2021, age 3 to 17, have been said to experience some kind of mental, emotional, developmental, or behavioral disorder. Newer stats 2023 say that youth, so middle school and high schoolers, about 20% are reporting anxiety symptoms. I think we'd probably all agree that it's probably more than that. Um, 4 in 10, so 40% of our students in middle and high school have persistent feelings of sadness and hopelessness. 20% are considering attempting suicide, and 1 in 10 have attempted suicide. So we all know these numbers, but every time I say them, they still hit that our kids are really struggling and they need all of us. So where are these kids? How can we reach them? You all play really important roles at school supporting these kids and families. And kids are actually in both home and school for about the same amount of time during the week. So it is equally important that we are focused on helping them with their mental health in both the home and school settings. I don't know about you, but I don't think high schoolers are sleeping 34% of the time, but that's what the stat said, so I'm going with it. So all of us want to be helping families and kids who are struggling, and we are all here to do this together, but we all know there are lots of challenges, right? What if families are hard to reach from school? What if families aren't responding to our outreach? What if students don't want their families involved because they're older and want to say in this? What if families are feeling pushed out of the school system? What if schools don't understand the family and the cultures that they're coming from, right? What if? You all could list a bunch more. Um, well, there's all those what ifs, and the solution to helping kids have positive outcomes for their education and their mental health is partnering with families, partnering across systems. So I'm going to talk a little bit about the barriers and then talk about some quick tips to partnering in hopes to help with mental health. So there are systemic barriers, there's school barriers, and there's family barriers, right? We're all very familiar with these. But to give you some context, the barriers the systems have right now are that secondary schools are actually set up to build autonomy in these kids, right? They are set up to teach independence and self-sufficiency, and families are told to step back at this time, which makes partnering even more challenging for all of you because families are told to step back, kids are being taught to be autonomous.
Thursdays from 11 to 1.
Schools and the education system have power. There's a power imbalance between the school system and family systems. So that puts a barrier in place for partnering. There's cultural differences between our schools and our kids and families that are coming in. and cultural differences between the people and the history that created our education system with what the values of current families are have. There are, you all know this, there are logistical and economical constraints that make it really hard for the partnering to happen. And mental health professionals often have these skills to partner, right? Many of you have these skills. You know how to partner with families, you know how to connect and engage them, but you're not always at the table. You're not always actively involved in that family contact due to the school's hierarchy or the roles that are set up in that system. And you tend to get pulled in to use your expertise a little too late sometimes. There are specific school barriers, right? So, the way schools are set up in our country is that communication often at the middle and high school, because there's so many kids in these schools, the communication tends to be deficit focused. So parents get phone calls and contacts home, not all the time. I don't want to make it sound like it's all the time, but a lot of the times when their kids are in trouble, when their kids are struggling academically, when there was a referral or a suspension, and and that's the way the system or the schools are set up. So that's the way the communication ends up happening. Staff at schools often feel uncomfortable with mental health. Probably not all of you, but the other staff feel uncomfortable with this and uncomfortable with family mental health, and they just don't know how to address it or work with it, and don't know always who in their teams at school to partner with in their school to help with connecting with families. Schools are confused about whose role it is to do this. There isn't always someone who's identified as the person who focuses on parent family school collaboration. And so there's role confusion on who should be taking this role. Also, there are logistical and resource constraints in schools. We all know that, but also you all are working really hard. And so the idea of adding more to focus on engaging families might be really difficult to think about doing if you're feeling burnout. Schools are reducing this family contact and experiencing these barriers just as kids need more help, right? The kids' needs are becoming more complex and youth are seeking independence. So in the schools, families are being told to step back, but kids' needs are actually more complex. And what are these changes we see at this ages of development? There's more mental health struggles. Kids are exploring their identity. They're trying to figure out who they are. And sometimes the identity that they're connecting with may be an oppressed identity, which adds to challenges for them in this setting. And kids are risky. They're trying out things, they're exploring, right? So all of this is happening at this time. And then families have these barriers to partnering with school. So the I hear schools, and we do this at the medical center too. We identify families as the challenging families, right? Um, those families are experiencing stress and fear and really a limited capacity. It's not that they don't care. It's not that they don't want to be involved in their kids' lives. It's that they really don't have the capacity to do so. And I know I'm preaching to the choir a little bit here. So your job isn't to convince them to engage, to make them engage, but it's more to help set up and be intentional about engaging families by reducing their load, reducing their fear, reducing this power imbalance across home and school. Another barrier for family are their times and finances. So especially nowadays, families need to work and they are just don't have as much availability or access to schools. And so that makes it challenging to be engaging them, especially during the school hours. And then families often feel blame or punishment from schools, and so they avoid them. The families that we're trying to reach the most have often had some tough experiences with school and are feeling ashamed and then withdraw. And then I just want to make a call out to this specific population. And this I will say these are the families that I see, right? Clinically, the families I see are families of kids struggling in school, of kids with medical conditions who are having a hard time going to school. And so, what I hear from this subset of families is that they feel like um, they pull away from partnering because they feel like the schools are judging them and their parenting. They feel like that school just really doesn't understand their kid. So they're actually scared to send their kid to school because they don't think it's safe. They're worried about how people are going to respond to their kid, especially kids with behavioral challenges. I hear families say that they feel scared to send their kid to school because they're afraid of what type of punishment might happen when they don't understand their kid. This, of course, just the family's perspective. And they feel like they're not believed, that their expertise and their kids aren't heard or believed by the school system. And and this causes a lot of stress for them, right? So these are families who are very high stress because their kids are usually in special education or disciplined often in middle school and high school, or they're in the juvenile justice system. So these are families who are very high stress and have tension with school. So this calls for the need to even partner with them more, right? Or differently. So we all have the goal at secondary school level to be building autonomy in kids, building their skills. But we also want to do that in a way that feels safe to them and to us and to the families. So how do we do that? This one's going to sound simple, but it's not. When you are working really hard to engage families and you're not having success, it's just human nature to think about families in a more negative way, to think that, and so I would challenge you all to be constantly reframing your mindset on families, to be reminding yourself that families are doing the best they can, and so are you, right? Everybody's doing the best they can for the kids. The kids are also doing the best they can. And to challenge yourself to reframe families, to remind yourself that families carry this very unique and intimate knowledge about their kids. And so pro professionals can't replace that, but you can partner with it to inform their education and help them do well in the education system. The other piece to think about is how much the family system impacts the kids you're seeing in schools, right? So I just want to take a second to have you think about your family. If you think about your family, what did you learn from them about education? What models did you have? What values were placed there? You all work in the school system, so my guess is you have a story there. There's a story of education being important. So when I think about that, I think about my mom was the um, school board president for many years in our small town. That obviously influenced how important education is to me and to my family. And I'm in higher education, right? So we all have this story of how our families have impacted our education. And the same goes for our students. Our students are learning about the education system and are learning about how to view or value academics or social emotional skills from their families. So, just to reflect, the things that we're talking about to help with partnering families when they're struggling are one, always reframe your mindset. Remind yourself that they're experts in doing the best they can. Two, think about if you know their family and spend some time or thought in thinking about what is the family system that this student is coming from. Ask yourself, do you know that? Do you know about their family? Have you sat down with the kid and made a family map? That's what this is. If you're not a family systems person, this is a genogram. In family therapy, we make this with all of our families. But you can easily do this with a kid that you're meeting with or talking with, and coming up with a family tree, identifying who are the important people in this kid's life? Do I know who they trust in their family? Do I know who their support people are in their family? Do I even know who's in their family and who lives at home? Um, I don't know, but Many times, from a family's perspective, what families tell me is that they are not asked about from the school professionals that they work with. So, so another way to understand why a kid and family are struggling is to know more, go towards it and be curious. This is a quick 5 minute um, uh, I don't, maybe it's a refresher for some people, but I'm going to quickly give you some ideas of how to understand families through a family systems lens and help you think about how this may show up at school. So for the family therapists in the audience, this will feel very familiar. Um, Behavior that we see in kids from a family systems perspective happens because it's adaptive in their family dynamic. Right? And what might be adaptive in a family system may not be adaptive in the school system or in a peer system with other kids. And so we may see that mismatch. From a family's perspective, systems perspective, there are different ways to understand this. So I'm just going to give you a quick rundown. Um, the child is part of an emotional system. The emotional system is their family, right? And children mirror the family dynamics that they see and they act out those emotional patterns that they see at home, at school. So if they're in a calm and supportive home, you may see a very confident, socially skilled kid. If their home is chaotic or tense or unpredictable, you may see a more anxious or more disruptive kid. So to understand what's happening in the home might help you understand why you're seeing this type of behavior at school. Another theme from family systems is this idea of differentiation of self. This is what we're working on in middle school and high school, how to help our kids be self-sufficient, how to help them learn how to be calm and think clearly under stress, right? And families are working on this with their kids too. So a well-differentiated child who can stay calm and think clearly under stress can handle peer pressure and criticism. They can handle that, they can tolerate that. A low differentiated kid from their family may feel overwhelmed, reactive, and overly dependent at school. So differentiation is also this idea of over time we want to differentiate from our families, right? And so if a kid is not well differentiated and can't calm themselves on their own and think under stress, then they struggle with regulation, and you'll see that in school. Children often carry roles in their family. So that would be also something to be curious about as you're learning about their family from their kid, from the child, is understanding what role they play. So in families, children can play roles like the hero or the scapegoat or the caregiver, right? And if you understand what role they play in their family, you're most likely going to see that role coming up in the school system. So our heroes in the family end up being those high achieving kids at school, right? That scapegoat in the family ends up being a problem child at school. So again, this is a way to understand how this behavior is showing up at school and how that's coming from family dynamics. Triangles are another family systems term. And what that means is that a triangle occurs when two people in conflict are pulling in a third person to stabilize tension. We see this all the time in schools. So that can occur when a child gets pulled into adult conflicts at home. You may then see at school, they're creating these triangles. They're pitting their teachers against their peers. They're seeking reassurance from teachers. They're creating these dynamics. With families who do not talk about emotions and are emotionally cut off, you may see that these kids are hard to reach emotionally at school. The families might be hard to reach emotionally at school, but that's the way their family system works for them. And so that's what they will tend to do in another system. There are also intergenerational patterns that happen with behavior or dynamics. So you'll see specific things being passed along the generations, right? Just like educational values get passed along, how people feel about academics gets passed along. So a parent who maybe struggled in school or had poor experiences in school are going to project that fear to their kids and maybe set their kids up to have certain views about school. So understanding a family's experience with the system is really important. All families, really all systems, but all families want homeostasis, right? They want that calm, stable place, and all families get into that homeostasis. So when there is a change, even if it's a good change, like a kid's behavior improving, it throws off the family. And it leads to change having to happen, just like in schools, right? We make a big change. Nobody likes it. It's a big change. Everybody feels uncomfortable, even if it ends up being a positive change. So so kids are trying to develop that in their home, and if being a certain way at home creates homeostasis, they may try to do that at school. So you may see a kid um, you might see a lot of behavior from a kid and you're wondering where is that coming from? But maybe at home that actually works for them, but at school it doesn't. So this was a quick review of some family systems terms and some different ways to think about how family dynamics might impact a kid at school. So back to what do we do? What do we do to connect with families who are struggling or that we want to partner with to help their kids and the educational outcomes of kids? Well, let's go back. Reframe your mindset. Um, Learn about the family. Do a mini family assessment. Even if you don't know how to do this, any curiosity to learn about a family system that a kid is coming from is going to be helpful for you. If you are all trying to help a kid with their education alone, you're going to see, we know this, right? The best educational outcomes come when there's partnerships across home and family or home and school. So these are just some examples of questions that you can ask. We've talked about some of them already, so I'm just going to move on. So reframe, learn about the family. And three, use these tips for partnering. So these are just best practices for partnering. I tried to put it in a very concise way for all of you. And you all have these skills. It's just if you're intentionally using them. Um, so STEADY is the acronym. And this is an acronym to summarize best practices to partnering with families. The first one is slow it down, right? Slow it down. When a family is dysregulated, when there's conflict between home and school, when maybe there's just a lot of stress, slow it down. Listen, validate, let them know you're here to work with them. Use your collaborative language. Stay there. Don't try to fix it. Don't try to problem solve. Right? I mean, you all know this. When people are dysregulated, you focus on slowing it down and being there. You need to build the relationship. That's the first step. Two, well, T is tell them what to expect. This is really important. And I think people, both in families and schools, think that they do this, but it doesn't happen as enough. So two or T is to tell them what to expect. Clarify roles. When you are working with a family, often families do not understand the roles in a middle school and high school. They're bigger schools. They've lost their anchor. They in elementary school they have that one teacher, right? They know I go to the teacher. But you get to middle school and high school, it's a lot more confusing for families. They don't know who to talk to. They don't know what roles people have. So whenever you're meeting with them, calling them, um, even just running into them, clarifying what your role is and what to expect from your role. Three, empathize, normalize. It sounds so simple, but it is not. Remembering to really empathize and come together on this is a hard time in development for students and hard time for families. And so really empathizing and giving them that, normalizing that stress is helpful. Oh, sorry. A is anchor the relationship. So identify one or two people at school to be the engagement person. Who is going to be the main point person for that family? Identify that person so that the family can have an anchored relationship. They know who their point person is, who they should collaborate with at school. It's always surprising to me when I see families that when I say, "Oh, who's your person? Who's the person at school you feel knows your kid the best or works with you the most?" Often they will say, "Well, I don't know when it comes to middle school and high school. Maybe call the principal." Like they don't know um, who they should be partnering with or who their other providers outside of school should partner with. D is do less and be feasible. So, we probably all like this one. We oftentimes, especially like an IEP meeting, right? These are long, very complex meetings for families. So when you have a specific goal and you want to meet with a family to address something, set it up so that it's accessible and set it up so it's brief, so it doesn't take up much of their workday, and set it up so it's very goal oriented. Someone runs the meeting, they identify what the goal is, you focus on that goal for that 30-minute meeting or maybe it's a 10-minute phone call. And then the last one is why, which is your follow-up matters. So, especially for kids struggling or families struggling, having a follow-up plan, a strategic plan for how you're going to follow up and engage with families is really key to building that trust and that relationship, which will then only make the engagement easier later on, right? So, and the best example I can think of is you every 5-week report, whoever that anchor is, whoever that person is, reaches out to the family. And maybe the family won't respond, but after Mr. Anderson calls every 5 weeks, or sends an email every 5 weeks, they're like, huh, wonder who this Mr. Anderson is. He really cares about my kid, right? And I'm just picking on you because you're right in front of me. Um, so that reliability really builds that trust. And it's something, again, that transition from elementary school to middle school gets lost. So we're trying to reestablish that in the secondary school to help with engagement. Okay, I think I'm running out of time. So I just want to say I do have some resources. These are some oldies but goodies and a newer book. But these are the books I lean on every time I want a refresher on how can I get better at partnering with different systems that kids are in. Um, I think these will be available for you. But these are some classic books that really give you some good ideas. And then as far as resources in the community, you all probably know more than I do. Um, but I did want to let you all know that we are here at Strong and Strong Family Therapy Services. We see kids and families, couples, for family system support. But I think for many of these and families that we're talking about, they really need accessible care. So it's hard for them to get out and get to a different clinic. So you all know, I think, that there are mental health clinics. Luckily, we have a community where mental health clinics are integrated in a lot of our schools and many of the schools that are here, right? Through our medical systems and also through different youth and local community organizations. So I always say, when you're working with a family who's struggling that needs mental health support, start with asking them where they get their medical care and where they're connected in the community. And if there's already a mental health clinic there, that's where you want to start them off because it's just going to be easier and more accessible for them. And then you can look at these other family resources. If you do want to learn more, just one more thing, you are welcome to reach out and we do have some advanced training courses at Strong Family Therapy Training Program.
Thank you so much, Michelle. Thank you for a really great, you did a beautiful job of packing a lot into a short amount of time. We will share all these slides so people can go back. I love the acronym and some of those really specific steps that schools can take. We are going to go into breakout rooms for just a few minutes before we move to our case presentation Michelle has a couple discussion questions for us to think about. So the two questions I'm putting in the chat right now. One of them is around in what ways you've observed families influencing both those challenges and the successes that children experience in school, and what strategies have you found effective in building partnerships with families, especially when there are barriers around engagement. So I'm going to put you into breakout rooms and we'll talk for a few minutes together, reflecting on the didactic, and then we'll move to our case presentation today with Rochester Prep. So let me just open the breakout rooms and we'll come back in a few minutes. They are open.